Okay, so in this video, we'll be administering vitamin K and erythromycin eye ointment to the newborn. So the first thing that you want to do before you get started with the administering of your medications, you want to do your 3 safety checks. So your first safety check would be when you're getting the medication out of the client's drawer. You want to check the name, the date of birth against the MAR. You want to check the dose. You also want to check the dose. You also want to, if you have to do any type of calculations, you want to do it at that time. And you want to check the expiration date of the medication. Check the medication. Your second check would be when you're preparing the medication, which is at this time you'll be doing your calculations as needed, checking the dosage, checking the name against the MAR, check your name against the MAR again also. Your third check that you want to do is once you have prepared your medication, you want to make sure you close the client's drawer. You want to make sure you lock it, lock your area, and you want to make sure that you do your first 2 checks in a quiet area where you can focus on what you're doing and make sure that you get your steps correctly. Your third check will be at the patient's bedside, where you're going to check the label again, check the patient's name, the identifying measures again against the MAR at the patient's bedside as your last check. Then you want to make sure you want to do your 10 rights of administration. So it's the right medication, the right dose, the right time, the right route, the right client, the right education, the right documentation, the right to refuse. The patient has the right to refuse, and if the patient do refuse the medication, then you would need to have the patient sign a consent form saying that they refuse this medication. Then you want to make sure you do the right assessment for whichever medication that you're given at the time. If there's any assessments associated with it, you want to make sure that you do those assessments before you administer the medication. And this also includes, like, if you have labs that you have to look up, lab values that you have to look up before you administer the medication. And then your last one is evaluation. This occurs when after you get give the medication, you want to monitor the patient for any adverse effects, the patient's response. Also, like if you're given a pain medication, you want to come back and evaluate the patient's pain level to see if the medication is being effective. Okay, so once you've completed, your 3 safety checks and your 10 rights of administration, then you can go into giving the medication. So the first medication that will be given to the newborn is vitamin K. And now with vitamin K, you want to make sure that the newborn dosage for vitamin K is 0.5 to 1 milligram. Anything more or less than that, then that should signal a red flag. Okay, so for the administration of the vitamin K, for newborns, you don't want to use the gluteus area. You want to always use the inner the inner portion of the thigh. Okay, so you want to draw your medication up to the dosage. Once you draw your medication up, you want to change the needle For a newborn, a 26 gauge would be the preferable size needle for a newborn receiving vitamin K. Okay, so you want to get your area after you've changed your needle. You want to get the area. You want to hold the inner thigh with your thumb and your index finger, pushing it down. You want to clean it with the alcohol swab. Then you want to go in. You want to go in with the needle at the 90-degree angle. Okay, and then you want to before you push the medication in, you want to aspirate a little, and you're aspirating to make sure that you're not in the vein, that you're actually in the muscle. If blood, when you aspirate, if blood come up, that means you're in the vein, and then you will have to redo the whole steps over. If you aspirate and it's no blood, then that lets you know you're in the correct area. Okay, so once you're at a 90-degree angle, once you aspirate and see that there's no blood, then you want to gently push the medication in. Okay, once you push the medication in slowly, you want to wait for a few seconds. Then you want to retract the needle and you want to apply pressure. Okay, and when you retract the needle's going to go up into the syringe, so therefore the needle is not exposed. You want to make sure that you put pressure on the site, and you want to make sure that you never rub the site. Okay, so you put the pressure on it, and then you want to put a band-aid. Okay, after you do that, then you want to dispose of your needle in a sharps container. Oh, I don't know if I said that. You always want to make sure, of course, that you wash your hands and you put on gloves. I don't know if I said that or not at the beginning, but always you wash your hands and put on gloves before you do the procedure. Okay, and you, like I said, you put your needle in a sharps container, and that concludes with giving your vitamin K. Okay, now when you're doing erythromycin eye ointment, okay, you want to have the infant, you want to make sure the infant is in a position that, you know, the head can be tilted back, so you can tilt it back a little to where you can get to the eye. Okay, so the head is tilted back, and you want to go to the eye, and you want to gently pull down the lower lid of the eye, and which this exposes the conjunctival sac. Okay, all right. So, and then you have your medication, and you have the conjunctival sac exposed, and you want to go from the inner campus to the outer campus of the eye, and you start at the inner campus, and you want to make do a small ribbon of medication from the inner campus to the outer campus, and then once you do that, you want to let go of the lower eyelid, and then you want to close the top eyelid. And when you close the top eyelid, this helps the distribution of the medication to get within the eye. Okay, and so once you finish that eye, you want to do the same steps with the next eye. Okay, after you completed the next eye, if you look and you see that it's an excess of medication that might be dripping out or whatever, you can gently clean the excess with the tissue on the sides. Okay, and once you've done with your medication, you're gonna come back up and do you want to do all your documentation with the vitamin K, given the area of where you did the medication. Yeah, you want to make sure you do that, and make sure you document your time and everything like that. Okay, and your evaluation, you're gonna check on the response the patient is having, And that concludes the administration of vitamin K and erythromycin medication.